heavy menstrual bleeding's medical term is called menorrhagia. And actually the most commonest cause of menorrhagia is unknown. So 70% of patients who experience heavy menstrual bleeding, we don't actually find out the cause of their bleeding. And that's termed abnormal uterine bleeding. Previously it used to be called dysfunctional uterine bleeding. And that's after going through a lot of investigations. Actually, we found no cause other than the fact that their uterus sheds a lot of endometrium, and that sheds and bleeds heavily. So out of the causes that we do know, the 30% of causes that we do know, we find out that actually patients have either got an endometrial polyp, or they got fibroids, or they got a condition called adenomyosis. And adenomyosis condition is seen actually in can be seen in endometriosis as well. So people with adenomyosis are very likely to have endometriosis as well. Other conditions include malignancy, cancer, and they're usually the older patients who've got postmenopausal bleeding and things. So they're the most commonest cause of heavy menstrual bleeding. What we say to patients is really, to have a period is normal, but however, if you feel that your bleeding is so heavy that it's causing you a decrease in your quality of life, or it's just causing you concern, for example, I have patients who are teachers or lawyers and they find it embarrassing because they have to keep going to change their pads. So if you're having to change your pads more often than is comfortable for you and it's interfering with your quality of life, your activities, daily living, like your work or your home life, then that's when you should seek medical attention, medical help. And there's lots of treatments out there, you know. We like to subdivide them into non-hormonal and hormonal. So we would, we'd obviously do some investigations, like some blood tests and scans, and correct any anemia, which can help patients who've got fatigue and things like that. We'd also look for the cause of anemia. So we'd do hematinics and other blood tests to investigate, is it iron deficiency, which is the most commonest cause, or folate deficiency, and we'd correct that. Then we'd also want to do a transvaginal ultrasound, and probably different investigations depending on the individual circumstances. So the patient does need to go and seek medical advice. We might end up having a sort of a hysteroscopy where we have a look inside the womb and look for the polyps or any other fibroids. You might need fibroids removed, you might have a malignancy and you might need that managed as well. All in all, if it happens to be a benign cause, or like the 70% you've got abnormal uterine bleeding, then we may need to, if the non-hormonal things like tranexamic acid or methylenic acid doesn't work or is not effective enough, we may need to try more hormonal management like combined pill, mini pill, implant, Mirena coil, and they can be really effective as well. So there is a lot we can do to help improve this cohort of patients and improve their quality of life. So all in summary, I'd say if it's really affecting your quality of life, definitely seek help. There's lots of things we can do depending on what's the specific problem for that person.